Okay, today with me is Swan alumni. That includes Shadan Medical College, VRK Women's Medical College, Ayan Medical College, and Nimra Medical College. And from the other side, we have Syed Salik, who is representing Swan today. So today is 17th in the beginning of the Cervical Cancer Prevention Week, and we have planned to go live to just create awareness about cervical cancer prevention. So I think let's start. It's time. It's already 6:31, and as you said, we'll start by 6:30. So this is a cervical prevention week. So each day there are two women who lose their battles to cervical cancer, despite it being the one of the commonest cancer among women below the age of 35 years. And still, despite it being the most common under the age of 35 years, many women don't even know what a cervix actually is and what is its function. There have been a lot of surveys done, and it has shown that almost 43 to 50% of women do not actually know what a cervix is, what part of the body it is, and what is its function. There's hardly anyone who could answer it, or very few of them know what actually the cervix is. So to mark the beginning of the cervical cancer awareness, cervical cancer prevention awareness, we have planned to conduct this live to make you aware of the cervical cancer, how can it be prevented and all. So let us first start with explaining you what exactly a cervix is, right? So I have a medical student with me, okay, Ms. Khan, who will actually tell us what a cervix exactly is.
Hi.
Hi, Ms. Khan. I think there's some connectivity issue which is occurring.
Yeah, I think
So
so.
we were just
Can you hear me?
discussing about cervical cancer, and
Yeah.
I was just talking about the surveys which had happened, and which had shown that women don't know about what a cervix actually is, what part of body it is, and even if they know it, they don't exactly know what is its function. So can you just
Yes.
start explain, because you're just completed your first year, so you actually can give us a detail about what actually a cervix is. So please go ahead.
Yeah, sure. So, I'll just show you the photo and I'll just start describing it. So, here it is. Okay. So, basically, the cervix, also known as the neck of the womb, is the lower cylindrical part of the uterus. It is about 2.5 centimeters long and is slightly wider in the middle than at either end. The lower part of the cervix projects in the front wall of the vagina, which divides it into supravaginal and vaginal parts. The vaginal part of the cervix projects into the front wall of the vagina. The spaces between it and the vaginal wall are called the vaginal cornices. The cervical canal opens into the vagina by an opening called the external os. Os meaning a mouth or an external opening. External os is the external opening of the uterus. In a nulliparous woman, that is a woman who has not born child, the external os is small and circular. However, in a multiparous woman having born more than one child, the external os is bound by an upper and lower lips, both of which are in contact with the back wall of the vagina. The cervical canal, that is, the cavity of the cervix, is fusiform in shape. It communicates above with the cavity of the body of the uterus through the internal os, which is the internal opening of the uterus, and below with the vaginal cavity through the external os. The canal is flattened from before backward so that it comes to have a front and a back wall.
Okay. So I just hope everyone has seen what exactly the cervix looks like. Anyone has any doubts, any queries, anything from anyone? Anyone from the audience have any questions about what is cervix, uh, about the structure of the cervix? No one? So I think let's move ahead and then going with the functions of the cervix. Okay, uh, basically the function of this, it is a lower part of the uterus. Okay, it is a lower, usually called the neck of the uterus. It is usually for cervical production of cervical mucosa during the most fertile phase in the menstrual cycle, which helps the sperm travel through the vagina and enter into the uterus. Now, it also helps in the opening during labor. It also forms a lower segment. It forms the the lower part of the uterus for and prepares the uterus for the delivery of the baby. So, and it also protects the uterus from the any infections. It is usually the entrance to the uterus, so it produces various secretions and all, and protects the inside of the uterus from any infections. And during pregnancy, it prepares for labor. So then so that is about the structure and function of the uterus. So anyone has any queries related to it? No one? So I guess everyone has understood what cervix is now, because that is
Yes.
our main thing of doing this live, to make the audience understand what a cervix is. So
Yeah.
I hope, yeah, so there's no one coming up with any doubts. So let's move ahead.
Yeah.
Yeah. So now evidence have shown up that around there are about 3 in 4 women who do not get their cervical cancer screening done. The women have been diagnosed with cervical cancer. Out of them, 3 women have not got the screening done in India, despite it being one of the most commonest cancer. Again, mentioning it under the age of 35 years. So why is screening important? Okay, we should be knowing why the screening is important. Okay, prevention is very crucial to fight against cervical cancer. Okay, so as cervical cancer test is a method for the detection. Am I audible? Am I audible? Salik, am I audible? I'm not getting any response, and there's some connectivity issue.
Yeah, yes, you're audible.
I am audible, right?
Yes.
Yeah. Yeah, so exactly what we were talking about. Why is screening so important? Okay. Um, Prevention is crucial to fight against cervical cancer, as often it has no symptoms which are seen in the very early stages. And if we are able to detect very early changes in the cervical cancer, then we will be able to treat it better and prevent its progress. Okay. Yeah, and the earlier these are picked up, the better is the outcome. Not being screened regularly is one of the biggest risk of the cervical cancer. Okay, and how can we prevent it? Okay, there are various things about it. That is routine screening and early detection of this screening. Okay. Another tool is for taking HPV vaccine, but again, it only prevents you against 2 variants. So it cannot completely prevent cancer. So, when I had posted about we doing a session about about prevention of cervical cancer. There were many people who messaged asking me about is we have already taken the vaccine, so will we get cancer? Will we still get cancer? So again, mentioning HPV vaccine is what maybe you've taken, and it will prevent you against only two variants and nothing else. Okay, so and then coming up, moving uh, forward. Okay, when should the screening be done? Okay, so anyone can come up with when should the screening be done? Anyone has any idea about it? Anyone has got it done? So I think I should only talk about it because no one is answering here. So the screening should be ideally done once in 3 years for women between the age of 25 to 49 years. And for the women between 59 to 64 years, it can be done once in 5 years. And after that, it should be done only when it is required. Yeah, someone's answering me. It should be done once in 5 years at from 21 years. No, it should be done after 25 years of age. Until 50 years, we should do it once in 3 years. And then after that, once in 5 years till 64 years of age. And after 64 years, usually the risk decreases. So we can do it once only if there is any symptom or any indication after that. Okay, and yeah, and if a lady is pregnant, ideally we don't advise you to get it during pregnancy, only and unless if it is indicated. You can get it done after 3 months after you've delivered the baby. When do you get it done in pregnancy? In case if you have delivery. Okay, and yeah, one more important thing for prevention is about identifying its symptoms. Okay, what symptoms ideally will you observe? In a very early stages, you usually don't have any symptoms, but then still you might observe some irregular menstrual bleeding, irregular discharges, vaginal discharges. You can have pain or a lot of discomfort during intercourse, and they can be some unexplained back pain or pain between your hip bones. Okay, you will feel pressure over your pelvis. Okay, so that is there. How can the screening be done? Okay, in case as I've mentioned about as I've mentioned about what the particular age group you are supposed to go for, like once in 3 years between the age of 25 to 49. So in case if it's once in 3 years, go to your general practitioner, go to your gynecologist, take an appointment and get your pap smear test done. The report will be available to you between 5 to 7 days, and then review the report with your gynecologist or your general practitioner, and they will help you understand it. Okay, so anyone has any doubts? Yeah, I'm getting what kind of indications? Indications, as I've mentioned, first of all, you go once in 3 years, and other indications will be some abnormal bleeding. Like if you have irregular pattern of bleeding, or you have some irregular discharges, then you can go for it. And anyone else has any other questions? Yeah, if anyone has any questions, we'll just take a break and then we'll tell you how exactly what test is done. The test is called a pap smear test or a cervical smear. Okay. Yeah, are able to join? Because I've been accepting requests I've been getting, but it's not getting accepted.
Yep. Hello, everyone. Can you hear me?
Hi. Yeah, this is Sarah. She's a doctor at KIMS. So, Sarah, can you just tell us, how is actually the pap smear test done?
Yeah, sure. So basically, thank you for the warm welcome, Dr. Fatin. Today, I'll be talking about how the test is performed. So, whenever a patient walks in the clinic, the first and the foremost thing before starting any procedure is to take patient's consent. As long as a patient is not comfortable, we don't proceed with the test. Once the consent is given, we proceed by asking the patient to undress herself from the waist down below and lie down with their heels close to their buttocks. This position makes it easier for both doctor and the patient. Once ready, the doctor will start off by looking at the external genitalia for any rashes or any discharge or if there is any bleed. Ideally, it is not recommended to get the test during your periods because it is believed that high flow can alter the accuracy of the result. However, it depends on the specialist you consult. Moving on, once the inspection is done, the doctor moves on to use an instrument called speculum. It has two lips, just like a duck bead, that will be inserted as it helps to give a better view of the mouth of the cervix. Under strict aseptic conditions, the doctor separates the labia with her left hand and inserts the speculum with her right at a 45-degree angle. And she tries to like rotate it slightly and locks it in to hold in a stable position. Well, most of you have been thinking if the examination is going to be painful. Let me be clear on that part, that this examination won't be painful, but can be slightly uncomfortable. However, you can stop your doctor when you have like extreme pain. Now, once the speculum is inserted and held in position with the help of a cervical broom, which is another instrument available in the kit, it has a small brush to its end, which is then inserted up to the mouth of the cervix and rotated in a circular motion. We then carefully remove the broom, put it in the solution and mix it in for 2 to 3 times, followed by removing the speculum and discarding it. Well, that's it from my part. If you have any questions, please drop in the comment section below. Thank you for listening.
Yeah, thank you, Sarah. That was nice. I didn't want to interrupt you. So we have a special
Yeah.
guest who already joined us. So this is
Okay.
Dr. Uh, Vijay Karan Reddy, the radiology oncologist from Apollo. Hello, Dr. Karan. Welcome to our live.
Hi, guys. Hi, Fatin. Thank you so much for the warm welcome. Yeah, hi, everybody. I'm Dr. Vijay Karan Reddy. I'm a radiation oncologist working at Apollo Hospital. So,
Thank
I
you
first
so
of all,
much, Dr. Karan, for joining us.
I want
It's
to
a pleasure to
congratulate
have you
first.
here.
I was looking forward for somebody to do this, and cervical cancer prevention is very, very important. We all know cervical cancer is one of those few cancers which can be preventable and is also highly curable. So, getting your test done, getting the vaccination done on time, and catching it early, even if you do get cervical cancer, is very, very important.
Yeah, so we have just explained about what exactly is the cervix and what are the symptoms, etc. So, would you like to add in something, Karan?
Yeah, so I would concentrate and I would emphasize more on the prevention part, the screening and prevention part. I think you have already mentioned about that you have to get a pap smear done. It can either be a HPV test or a pap smear test. And Dr. Fatma has actually explained. I'm sorry if did I get your name right?
Yeah, yeah.
She explained it very beautifully how pap smear is done. Usually patients have a lot of apprehension before they go for a pap smear. They think that it is painful and not comfortable, and they're very conscious about getting it done. And many of them have a social stigma that they're going and getting tested for cancer, and they should not tell people around them and not tell their family. So same way, the diagnosis also gets very delayed. So the recommendation as per international guidelines is that any female between 25 and 55 have to get a pap smear done at least once in their life. And like you said, doing it once every 3 years, if you get two consecutive pap tests negative, then you can stop the screening process in a
Okay.
coming to prevention, the vaccination that you were talking about. So there are initially the first vaccination that came out was bivalent, which was against 16 and 18, which are the most HPV 16 and 18, which are the most common and highly infectious types for cervical cancer. Now we have tetravalent and uh, a vaccine against 8 different types as well. So in India, we have tetravalent available, which is called Gardasil. And yeah, so that actually protects you against 4 different types of HPV, apart from the 16 and 18, which are the high risk types. So the recommended age group for vaccination is starting at US guidelines say 9 years of age. We used to make it simple for patients and say, at the time that when you get married, because that is when your sexual activity begins. But technically, any woman from the age of 10 years to the age of 26 years are fit to take vaccine. And the vaccine is given in 3 doses. It is at 0, 3, and 6 months.
Okay.
Yeah.
So we have prepared a list of questions, and we will also take up questions from the audience. But then we had a few of our medical students who had come up with a lot of doubts. So I thought you will be the best person to answer it. So we
Sure.
have Sanya, a medical student. So she will start asking you a few questions.
Sure. No
Sanya,
problem.
please go ahead.
Yeah.
Good evening, sir. Can you hear me?
Yeah, I can hear you. Please go ahead.
Okay, how are you doing?
I'm doing
So, I got a list of questions, so I'd like to start.
Sure.
So, I would like to ask if it's necessary to get HPV vaccine.
It is definitely so. 90% of the cervical cancer it is caused is by the HPV virus. It is the most common causing factor. So HPV vaccination, even though it is not 100%, it definitely helps control and prevent cervical cancer times.
Yes, sir. So, my next question is, can a lady get pregnant if she gets infected by HPV?
Yeah, I mean HPV infection, even though there is a possibility that she might develop cervical. It's okay. I'll put it this way: the latency period for a HPV infection to become cancer is about 15.
Okay, we have disturbance from someone's side. Because I think we're not able to hear Dr. Karan properly. So someone
Yeah.
is looking who is having the disturbance, please.
Is it clear now? Better now? I think so, right?
Yeah, better.
Okay, so the latency period between an HPV infection and the person actually getting cancer is about 15 to 20 years. So repeated HPV infection, when they're not treated, only then it develops into cancer. So having an HPV infection and going into pregnancy is not at all a contraindication at all. I think a gynecologist would be in a better position to answer that, but yeah.
Okay, then my third question is, can smoking or alcohol increase the risks of cervical cancer? If so, how?
So simplest way this is smoking is responsible for every single cancer in the body, either directly or indirectly. Because of all, there's some chemicals in smoking called carcinogens. There are about 1,000 to 2,000. That is the only substance which has the highest number of carcinogens that can be inhaled or taken in by a human body. So all these carcinogens can cause any kind of mutation in any of the cells in the body, which leads to uncontrolled cell growth and which leads to cancer. So that same holds good for cervical cancer also. When it comes to alcohol in moderation is still okay. Moderation, I mean maybe having 30 to 60 ml per week, but there is no moderation, anything called moderation in smoking. And when you mix both together, it is the most fatal mixture.
Okay. Then my next question is HPV only sexually transmitted?
Can you hear me? Sorry, I got a call by mistake.
Yeah. We can hear you, Karan.
Yeah. So my next question is HPV only sexually transmitted?
Yes, HPV is transmitted both sexually and also through body fluids. So it
Okay.
is apart from cervical cancer, it is also known to cause oropharyngeal cancer in adults. So one of the causes of transmission of HPV through the oral cavity is through oral sex. So body fluids and sexual transmission are the two more common ways. So
Then,
because that question, I'll also
hello.
add, hello, can you hear me?
Yeah,
Yeah,
yeah.
we can hear you.
Yeah. So this is for the reason why HPV vaccination is recommended in men also, because it can prevent oropharyngeal cancer.
Okay.
So,
And
what is
I
the
would like,
ideal age for men? So, any particular or only if it is indicated?
It is the same age group of 15 to 20 years of age.
Mhm.
There is no particular
Okay.
indication as such. So if you're aware
So,
of
in
it, you want
India,
to.
do we encourage to take it for adult boys also? Do they
As of now,
encourage?
yeah, I would, if somebody asked me, I would definitely encourage them to take it. But as of now, all the education is more directed towards getting it for men, because HPV,
Okay.
oral cavity, or oropharyngeal is only 60% of the cancers in India are HPV positive, whereas when you look at Western population, around 80% are HPV positive. So because of that, it is
Okay.
recommended more in the Western countries than in India.
That. So, did you see any increase in rate? Is there any increase in particular gender?
For HPV infection or cancer, you're saying?
HPV infection.
HPV is less than 50% of the population in men. It is very, very common in women. The main issue with HPV infection is that most of the times it was asymptomatic. Because of that, people don't even know if they had an infection and it subsided on its own. And having repeated infections, suddenly by the time you're 35, 40, you end up having cancer.
Okay. So there is no screening for this. Like for women, we have the pap smear. What about men? How do we screen them?
No, no, there is no screening recommended for men.
Okay. Yeah, Sanya, you can go ahead with your next question.
okay, my next question is what is the pathogenesis behind the symptoms of the cervical cancer?
So, like I said, most common causative organism, causative factor for cervical cancer is HPV. The symptoms are also based on that and follow that pathway. So, having a repeated HPV infection, it goes a stage by stage. First, it starts as cervical intraepithelial neoplasia, which is a benign condition. Usually, when the patient has any vaginal discharge or postcoital bleeding, or excess bleeding during menses. These are some of the common symptoms, and you get them tested, get a pap smear done. There is a possibility that it might be a pre-malignant lesion, which is cervical intraepithelial neoplasia. So it goes through 3 grades of neoplasia, that is grade 1, grade 2, grade 3. And once cervical intraepithelial neoplasia is done, the next stage comes is malignancy, which is atypia of the cells. So that is how the process is. So again, even if it is CIN 1, 2, 3, you don't not need any aggressive treatment. Uh, but HPV and excision of the cervical lips that they do, that itself is good enough for pre condition.
Okay.
Okay. And what are the measures to be taken to prevent cervical cancer?
Prevention cervical cancer is only through vaccination. That is 9 years of the age group that is. Uh,
Hello?
can you hear me?
Yeah.
Yeah, HPV
Hello?
prevention is only through vaccination.
Okay. And would you like to tell what is LLETZ or LEET?
So a gynecologist would be the best one to answer that in detail. But as of now, in the treatment of cervical cancer, those procedures are obsolete. We don't use them anymore.
Mm-hmm.
What follow-up tests would the patient need after the treatment?
So let me talk about the treatment first. So treatment of cervical cancer depends on stages. I'll explain the stages of cervical cancer. Any cancer has 4 stages, right? It's stage 1, stage 2, stage 3, and stage 4. So stage 1 is when the tumor is limited only to the cervical lips and does not spread anywhere beyond it. Stage 2 is beyond cervical lips, it gets into the fornices and the adjacent pelvic wall. Okay, they call parametrium. So cervix, fornices, and parametrium is stage 2. In stage 3, it goes beyond parametrium up to the pelvic wall. So from inside to outside, as you move from cervix to fornices to parametrium and then pelvic wall is stage 3. And stage 4 is when it spreads into the other organs, like uterus going into the bladder, or it already spread into the abdomen or to the liver. Then that is stage 4. All types of cancers, the first site of metastasis is lymph nodes. So when the cancer goes from cervix to the surrounding lymph nodes, it's still stage 3. Metastasis means don't think that it is stage 4. Nodal metastasis is still locally advanced disease. It's not stage 4 disease. So in cervical cancer, lymph node involvement is stage 3. So stage 1, 2, 3, and even in stage 4, if it is only by involvement of the adjacent organs, we can still try for treatment. Stage 4, when it spreads to other organs in the body, that is either the lung or the liver, or sometimes it goes into the neck also and the mediastinum also. In those stages, we cannot cure the patient. We are only trying to control the disease. So in these 3 stages, depending on the stage, there are 3 options of treatment: surgery, chemotherapy, and radiation. If it is stage 1, you need only surgery. So they will remove the uterus, that is a total abdominal hysterectomy, a type 2 hysterectomy they do. So that itself is the treatment for cervical cancer in stage 1. Once it comes to stage 2, because it is little more advanced, moving away from the cervix also, there are 2 ways to go about this. One is, some doctors, what they do, they operate first, that is they remove the do the total abdominal hysterectomy and then give radiation. But the newer studies show that the patient does not need 2 modalities of treatment. Even if we give only radiation, she will have the same cure rate. So you don't need to operate on them. So stage 2, we give radiation. Stage 3, we give radiation along with chemotherapy. Stage 4 is again radiation, chemotherapy. And when the situation comes that it has already spread to the lungs and the chest and mediastinum and all that, then we do only chemotherapy. So this treatment, radiation, will be around, the entire course of treatment will be around 2 months. It's about 6 to 8 weeks. So the patient has to come daily for treatment. Radiation, in local language, they say that, they're giving shock dete hain, current dete hain, because, people don't understand, but it is not exactly that. Radiation is basically X-ray treatment. So the X-rays that you take, like a chest X-ray, or, take a X-ray of a fractured hand or something, they are kilovolt X-rays. So the same X-rays, we use million volt X-rays, very high energy X-rays, and we direct to the area that we want to treat. Apart from the tumor itself, we treat the microscopic disease in and around the uterus also. So the patient has to come to the hospital for 10 minutes every day for a period of 5 weeks. This will be external treatment. After this, they will have 3 weeks of internal treatment. That happens once a week, not every day. So internal treatment is what we call brachytherapy, where the radioactive radiation source is kept directly into the cervix. So that maximum dose can be given to the tumor. When you give external radiation, you cannot concentrate the radiation dose to the tumor. The surrounding structures get it. So because we don't want to, damage the bladder and the rectum, which are around the uterus, we give internal radiation. So the entire process takes about 6 weeks. Along with this, the chemotherapy is given as once a week chemotherapy. Again, chemotherapy also is a daycare procedure. It is over 4-5 hours given as IV. What chemotherapy?
How many sessions do they have?
So 6 weeks of chemotherapy, you will have 6 weeks of radiation, will have 6 weeks of chemotherapy once a week.
So every day. Okay, once a week.
Once a week. So the point of giving
So total 6 sessions.
sessions. So the point of giving chemotherapy is that it potentiates the effect of radiation. So radiation is your primary treatment for cervical cancer, but adding chemotherapy will give that added 5 to 10 benefit and increase the effect of radiation on the tumor.
Okay.
Once the treatment is done, there will not be any investigations as such. We call the patient once every 2 to 3 months to come, and we just do a PV examination. We don't do any scans unless the patient is symptomatic. So usually after 6 months to an year, ideally what we follow is 1 year, because cervical cancer is a highly curable disease. We don't expect any untoward, things happen within 6 months. So usually after a year, we do a full body scan to make sure that nothing is going wrong. But otherwise, only a PV examination is good enough.
Okay. And what is the chance that the cancer will come back after the treatment?
So this again depends on the stage of the tumor. So if it is stage 1, it is 100% curable. Stage 2, it's 85 to 90% curable. Stage 3 is about 70 to 80%. And stage 4 is about 50 to 60. Stage 4, again, the stage 4 I'm talking about is an advanced stage 4 where only the surrounding structures are involved. If it is a stage 4 where other organs in the body are involved, then there is no cure. So when I say 95%, 80%, 70%, what I mean by saying that is, if 10 people of stage 2 if 10 people have stage 2 cervical cancer, 8 of them will be completely cured. They will not have a chance of any disease coming back. But 2 of them might have the disease coming back in a period of 5 years. Once that 5 years is done, you're considered to be cancer free. There will be no chance of recurrence. So the easy way to remember is 60, 80, stage 4, 3, and 2.
So it's quite reoccurable.
If it is advanced stage. But
Ideally, for stage 1
cancer,
and 2, what is the prognosis after it? Like uh, related to the health wise. So, what is the prognosis after its treatment, after it's been cured? Otherwise,
so,
what else can we expect in the patient?
so that is actually a very, very good question, Fatin. Most of the people are worried about life after cancer, and all our efforts are going into, all the studies that are going into concentrate on the fact that the patient should have a normal life after getting treatment with cancer. And cervical cancer is one of those where they will have a completely normal. So even though the cervical cancer post treatment, people to even sexual activity. A lot of people are apprehensive about that, but they should have sexual activity, because without that, what happens? They post radiation, there are a lot of adhesions within the vagina. So if they do not practice, regular sexual intercourse, then they might end up having vaginal stenosis.
Okay.
So apart from that, also they will have a completely normal life. Their diet will be normal. Their urine motion, whatever it is, will be completely normal. There will be no long-term side effects of chemotherapy or the radiation.
Okay. So, yeah. Sanya, do you have any more questions?
What are the signs or symptoms that a patient will look after the therapy, after the treatment, if
Okay. So
if there is a chance of reoccurrence?
yeah. So first, I'll come to tell you the signs and symptoms by stage. The stage 1, stage 2 signs and symptoms are vaginal discharge, post-coital bleeding, or excess bleeding during menses. Beyond this, if the patient has anything beyond stage 2, that when it comes to stage 3, a lot of them end up having a low back pain, very severe low back pain. So that is one of the symptoms. Post-treatment, for recurrence, you have to look forward for the same symptoms. If it is a local recurrence, they will have a discharge or bleeding. If it is an abdominal recurrence, they will have back pain or abdominal pain. If the recurrence is, stage 4 in the lungs, then some of the patients might have cough. Okay, cough and swelling in the neck. Usually it happens on the left side of the neck. So these are some of the symptoms that you need to look out for in metastasis or any recurrence.
Okay. And hello.
Yeah.
Yeah.
Go ahead.
We can hear you, Sanya. You can go ahead.
What are the complications in pregnancy that a woman will have to encounter after the treatment?
So after the treatment, we usually ask them to wait for a couple of years just to make sure that they do not have a recurrence. But beyond that, they will not. You do not expect any complications at all. People have a normal delivery and a normal, uh, their process of, I don't know what to call it. If they're in a
The
childbearing age,
entire.
yeah. So if they're in a childbearing age, they can continue to have their normal childbearing. It will not.
I had seen a case. This lady, she had been treated with cancer at the age of 28 years. And
Okay.
then she gave a gap of around 4 years, and then she had an IVF conception due to other reasons, nothing related to cervical cancer, but she wasn't able to conceive naturally due to other gynecological reasons. And then we took her, the entire pregnancy was smooth. We were getting her tumor markers checked from time to time. Okay,
Yeah.
various investigations required were done. Everything was normal. At 37 to 38 weeks, she herself didn't want a vaginal delivery. So on maternal request, we had gone for a cesarean for her. Otherwise, we could have given a trial for her.
Yeah. So if it's childbearing age, the only thing that you might want to consider is when radiation is given, the ovaries get also radiated. So the first thing that we do before we start radiation, depending on the age of the person, imagine the woman is 30, 35, a childbearing age, she has only one kid, she wants to have another kid. So we cannot delay the treatment as such. So what we do is we suggest freezing their eggs. So they go to a fertility center, freeze their eggs, finish their cancer treatment, so their ovaries are protected. Once the treatment is done, wait for 2 years, and then they go ahead with their pregnancy, whether it's IVF or a regular pregnancy.
Okay.
Can you tell us the risk factors for the cervical cancer?
Risk factors: HPV, HPV, HPV. The most common and the most affected is HPV. The second comes smoking. There is age also as a risk factor. The most common age group is about 30 to 45. Then a long-term use of OCPs for over a period of 10 years or so also increases your risk for cervical cancer.
Can you explain me how does OCP have a relationship with this? A little bit of its pathogenesis.
I'm not exactly sure of that pathogenesis, but I think it is more to do with the endometrium being excessively active more than usual because you continuously keep shedding
Yeah.
and excess release of hormones. So because of that, I think that is the reason why I have a higher risk. But the exact pathogenesis, I'm not really sure.
Okay, Sanya, any more questions?
Yeah, should the patient avoid sexual intercourse during the treatment?
During treatment, it is more of a conscious choice than anything else. It might be a little uncomfortable and troublesome for the patient, so they avoid it. But as soon as 1 month post treatment, 2 to 4 weeks post treatment, they can have sexual intercourse.
What? Hello?
Yeah. Go
Yeah,
ahead.
we can hear you.
What measures should a HIV positive patient take to prevent HPV infection?
So that is entirely dependent on the CD4 count. Obviously, when a HIV patient is there, they keep monitoring their CD4 count. And second thing is they need to follow the same measures of screening and prevention like a regular person, but it will be more intense. So for them, they will have to do a pap smear every year, like we do for us. We do once every 3 years. So they will have to do every year, and 3 consecutive pap tests being negative for 3 years, then you can stop testing them. But there is no specific precaution as such that they need. Screening and prevention measures remain the same for HIV patient as well.
Okay, so this is the last question of mine. Since there are many variants of HPV, which one is more related to cervical cancer?
16 and 18 are the most common and the high risk, which have been identified. So the bivalent vaccine, which used to be given before, was again 16 and 18. Now what we give is a tetravalent. So 16, 18, 5, and 8. Yeah. So 4. So the most common are 16 and 18.
Thank you so much, sir. Thank you for your time and your knowledge that you shared with us.
Thanks.
Thank you so much.
Thank you, Sanya. There are a lot of
Thank you.
questions coming up for you from the audience. So I'll read it out for you.
Sure.
Okay, so we have here, there's a question. We have known that for years that OCP protects against ovarian cervical and colon and breast cancers. Kindly tell us the association.
So OCPs, there are different types of OCPs, right? So the OCP progesterone will usually protect you against ovarian and breast cancer because they're very much dependent. But cervical cancer and colon cancer, there is no association of protection with. So even for a patient who has breast cancer, we actually give them, hormonal treatment for a period of about 10 years to make sure that they don't get a recurrence. So that holds good for like, breast and ovarian, but not so much for cervical and colon. So definitely not.
Okay. So the next is, which radioisotope has got the best results in brachytherapy?
Right now, what we use is 190. So it's a very specific question to be asked. Is that,
Yeah, it is from a doctor. So yeah.
uh, so what we use right now is iridium 92, and the reason for that is because it can be used as an after-loading technique. In the sense we can insert source into the patient, move out of the room, and then treat the patient electronically or computer. Second thing is it's got very long short life. So a particular source of iridium 195 can, once for about 12 years, 12 to 15 years. So the short life, longer time, sourcing it is easier and treating is easier.
Then next we go is the earliest sign of cervical cancer. I think we've discussed about it. Earliest
Earliest,
sign of
uh,
cervical cancer.
yeah, that is earliest sign is discharge or bleeding.
And does cervical cancer happen after menopause?
Yes, it does. So
Is
the most average age group is about 30 to 40, but women who have had hysterectomy post of 60 years of age also can have.
okay. So, and people are here appreciating you. There are a lot of messages telling you have given us excellent information. So we should thank you a lot. And then there is another question: is
So,
that my father is 62 and he's fully vaccinated. Should he go for the booster shot?
so this, yeah, so 62 in, okay, they're asking for COVID vaccine. I think so.
Mm, yeah, I guess so because we are talking about the HPV vaccine. So that's not linked to him.
So for post cervical cancer is not very common. It
Mhm.
endometrial cancer is very common for women 50 and over. Even
Okay.
though
So there's this thing. Other than the Pap smear, there's anything else? Any other test for screening?
so HPV testing and Pap smear testing, these are the two ways. There's another called a visual test
Okay.
where they put eye over the, this is usually used in people who are at high risk, who are having repeated infections, to make sure that there is no pre-malignant or a malignant lesion which is not visible to the naked eye. So you do something like a colposcopy, similar to a colposcopy, which you do a microscopic test, but
Mm-hmm.
they put a to make the dye will show where the blood supply is more. Usually, when there's an intraepithelial or a neoplastic lesion, the blood
Mm-hmm.
supply to that area increases and it is much higher. So they use this dye to visualize that part and make sure to see if there's any abnormal cells in the cervix. So these three tests: HPV, Pap smear, and a visual test. These three are the screening tests that we can do.
Okay. So there's another question. Can teenagers get cervical cancer? How long does it take to spread and be symptomatic?
So the youngest that we have seen is about 25 to 26. Teenagers cervical cancer does not happen. However, teenagers can have HPV infection. So as a person who has HPV infection, a recurrent HPV infection, when it starts at teenage, by the time you're 30, 35, there is a risk that you might get cervical cancer.
Okay. So when there are people thanking you and there are no other questions. If there's anything, please go ahead and ask. So ideally, whenever we get any patient in the gynec department, we advise them to go for the cervical cancer depending upon the history and thing. But there are many people, like as we've mentioned, 3 out of 4 women refuse going ahead for pap smear test.
Yeah.
So again, we encourage everyone to just go ahead with the cervical cancer screening. This screening doesn't mean that you are going to have cancer. It is just to screen you and see that everything is normal.
Exactly. So every that is the best way to do it. Instead of trying to explain the pros and cons at every moment that they come, it should be part of the regular checkup, regular workup. Any blood test that you do, just pap smear along.
Yeah, and there's a question coming up. What is the prevalence of cervical cancer in reproductive age?
So the most common time that a woman can get cervical cancer is in the reproductive age, from 30 to 44.
Okay. Can we know about any yeah. I was going with the next question.
Yeah, go ahead.
Yeah. So that is, can we know about any prevention measures against cervical or endometrial cancers?
Endometrial cancer, there is no prevention as such. So we would recommend every woman above 60. So the usual symptom that we see in elderly women is they have bleeding and spotting, and they undergo a colposcopic biopsy, and usually it says that there's atypical cells are there, but it is not cancerous, it is not invasive, and then they ask you to come back after 2 months again to repeat the same colposcopy. So best way to prevent endometrial cancer is 60 years and above, just get a hysterectomy done. And cervical cancer, like we have already discussed in this the last hour or so, HPV vaccination is the best way to prevent cervical cancer.
Can you just brief us about any pap smear report? Okay. Like sometimes, we just come up with the inflammatory cells. So inflammatory cells just indicates a minor infection.
Yes. So inflammatory cell is infection. So as I was explaining before, there are different stages. So the cervical intraepithelial neoplasia, which is a pre-malignant condition. There are 3 grades. So grade 1, grade 2, grade 2 can lead to grade 3. And once grade 3 is done, so there is dysplasia, metaplasia, and then comes malignancy. Intraepithelial neoplasia is dysplasia. When they mention in a pap smear that they have seen atypical cells, then it has to be investigated.
Yeah.
If it is dysplasia only, if it is only intraepithelial neoplasia and a pre-malignant condition, that will be clearly mentioned in the pap smear. If there is anything called atypia, then you have to evaluate for cancer.
Yeah, atypia is that we are able to see some cells which are not usually seen. Okay,
Yes.
that doesn't exactly mean malignancy, but some unusual cells are seen, and then you should go for further testing.
Exactly.
Right?
That do a more deeper colposcopic biopsy.
Yes. So the next question is there a cervical cancer screening program in India?
Officially not, but cervical cancer screening camps have been regularly going on. So a lot of these villages and districts, a lot of the NGOs do it, a lot of hospitals do it. We used to do it. Now because of COVID, doctors are not really. But like there is national prevention for tuberculosis and all that, there is no national prevention for cervical cancer. But it is done very commonly. Every lab, every hospital, every clinic can do a pap smear. It is very easy to find.
Yeah, and we've also explained you how it is done. So it's a very simple test which doesn't cause any pain. It is like a simple vaginal examination. So you shouldn't be frightened to get that test done. So, and nowadays we're encouraging every lady who's coming above the age of 25 years, between 25 to 35 years especially, we are encouraging them to go ahead with it. And I've seen many patients who are, when I'm asking them, did they ever get a cervical cancer test? And they're telling me that they've got it done in their annual checkups at their offices. So I think that way also they are encouraging to go ahead with the cervical screening. Yeah. Is there a link between prostate cancer and cervical cancer?
That is in men and this is in women.
Yeah, so two different organs, so it's nothing related to each other. So I think there are no other questions. Anything you would like to add?
Yeah, I mean, as a general statement, I would definitely would like to encourage everybody to get HPV vaccinated and get HPV screening done. I keep saying, I mean, I've also uh, posted articles online and in papers also, just iterating the fact that cervical cancer is one of the most preventable and curable cancers. The cure rates that I told you today are one of the highest among all the different cancers in our body. So when you can fight it, like compared to the last 15 years, in the last decade or so, the number of cervical cancer has come down drastically compared to what when like in the last 5 years when I was doing my PG to when I'm working as a consultant now, there is a huge change. Before we used to have 80% of our OP volume cervical cancers. Now it's only 10 to 15%. So we are going in the right direction, but we need to go further. We need to be more aware of the fact that it can be prevented. And the social stigma that is there in us Indians is a lot. That is a major factor for not being able to prevent and screen cancers properly, especially for cervical cancer. Like like your team explained, like Fatin explained, the pap smear is not a difficult test to do at all. It just takes a couple of minutes. It does not hurt you in any way, and that eventually can end up being a reason to save your life. So it is very, very important. And yeah, prevention is better than cure, as you all know. So please make sure that you do get this HPV vaccination and encourage your friends to get it as well.
Yeah. So there's one more question. Hypothyroidism, diabetes, and other hormonal diseases do they increase the risk?
Of cervical cancer?
Yeah.
No,
I don't think so.
they do not have any link to cervical cancer at all.
Okay. The risk of cervical cancer in married and unmarried women, which is more?
I would say married women only, because there's more sexual activity in married women, and the common age group is 30 to 45. That is married age, childbearing age itself. So the chance of infection, HPV infection, is much higher in married women.
So there's nothing else coming up. Anyone else has any other question? So thank you so much, Dr. Karan, for joining us. It was like there's so much of information, which even I didn't know. I got to know today. I was able to ask you so many questions.
Thank you so
Thank you
much
so much.
for being here, and congratulations to you and the Swan alumni to to be able to do this.
Yeah, it was just we thought of organizing a camp, but then because of the increasing cases of number of cases of COVID, we dropped the plan and we thought we'll go up with a live session and just try to grab as many people as possible. Uh, and we whoever wants to get a cervical or a pap smear test done, you can go to their just encourage them to go to their local diagnostic centers. In case if they are frightened, they can go to the gynecologist, and they can also DM us and we will guide them where to go and get the test done.
Yeah,
And
to me, if you
yeah,
need help and if you have a person in your family with cervical cancer, if you have any questions on cervical cancer, please feel free to DM me as well. And Fatin, I just wanted to add, now with this month, even we wanted to do a screening camp, but we were not able because of, we might postpone it to a next month or so, February or March. So there are two things. One is we are doing a screening camp for cervical cancer. Second thing is we are donating HPV vaccination to girls' orphanage. So
okay,
I would like it
that
if you
that
your friends could
sure,
join.
definitely we would love to be a part of it. Just give us the dates and all, so
Sure.
we will definitely be a part of it and encourage as much as spread awareness and encourage people to come up as much as possible. So
correct.
if people don't have any other questions, then I think I would like to end the session.
Thank you, Fatin. Thanks for having me, and good to see you again after a long time.
Yeah, we'll catch up soon.
Sure. Take care.
Bye. Take care.
Bye, everybody. Thanks for joining.
Thank you, everyone.